Hi, my name is Irene Patton. I am a nursing student from Nightingale College in Class BS in 206 Section 3. Today I'm going to perform oxygen administration skill. I have no nail polish or no jewelries on. I have the appropriate attire on with shoes and name badge. I have my supply here, non-rebreathing mask, nasal cannula, gauze, still water, alcohol sanitizer, and my patient. So oxygen is considered as a drug which need the doctor order to be placed in before we can admit or apply to the patient. So once the order is placed in or put in, we have to verify what type of devices we are going to use to deliver it for my patient. What is the flow rate and what is the duration of therapy? Once those are verified, then I go gather my supplies and go taking care of my patient. So I'm going to start performing my skills now. I was outside the door. I knocked the door. I opened and shut the door to provide privacy for my patient. And I'm going to introduce myself and the procedure, what I'm going to do with my patient. So first I'm going to put down my supplies to the dry clean place area. So, hi Mr. Patton, my name is Renu Patton. I am your nurse today. Can you verify me your name and date of birth please, and can you see your armband? Alright, thank you. So while asking my patient to verify the two identifiers, I was watching my hands, and while he verbally telling me his first full name, first and last name, and his date of birth, I check his armband and it's the same person. So, hi Mr. Patton. So doctor prescribed some additional oxygen for you, which I have the nasal cannula here. This device can give out 1 to 6 liters per minute, and if you need to use the oxygen more than 4 liters per minute, then you need to use the sterile water to attach to the verified oxygen source so that the oxygen will be humidified. So you get humidified oxygen. So this piece, Mr. Patton, will attach to your nose, and this tubing will loop around your ear, and the other side will attach to the verified oxygen source. Are you okay with that? Yes? Okay, thank you so much. So I'm attaching to the verified oxygen source and turn on to 3 liters as the doctor prescribed for Mr. Patton. And I am going to put in around your ear here and snug this. So now Mr. Patton have the nasal cannula on, which is fit on his face but not too tight. I'm going to put this gauze put on between your cheek to prevent some skin breakdown between I'm gonna put between your cheek and the tubing to prevent some skin breakdown. Okay, so time has passed and the doctor prescribed more oxygen concentration for Mr. Patton. So I'm going to remove nasal cannula and apply the non-rebreathing mask for him. So first, wash my hands. Hi, Mr. Patton. So the doctor prescribed you more higher oxygen concentration for you because your oxygen level is still not good. So I'm going to I'm going to remove nasal cannula and apply your non-rebreathing mask. Is that okay? Okay. So I want to tell you about the non-rebreathing mask before we apply. This non-rebreathing mask has the reservoir bags that need to be inflated at all time, and it will rest nicely on your chest while you're having it. And this mask that will cover your nose and your mouth. Okay, so this type of mask will provide you the flow rate at 15 liter per minute, and once the airflow this reservoir bag will be inflated, and it had to stay inflated at all time. So I am going to remove this nasal cannula and attach the non-rebreathing mask into verified oxygen source and turn on to 15 liters. Okay, I'm gonna remove this now from you and discard it. Okay, so I'm gonna apply this mask on. Mr. Patton. Okay. So I'm gonna pull this strips so that it fit good on your face, and snug this metal piece so that it's good on your nose. Also, I'm gonna apply this 2x2 gauze between your cheek so that prevents skin breakdown from the long-term use on the stripe pressure, and between your ear prevent the skin breakdown as well. So the non-rebreathing mask can produce more moisture than nasal cannula, which is we have to watch out for the skin breakdown on the patient nose bridge as well, along with the stripe that touching or pressing on patient's skin and behind his ear. We have to also check the nose bridge along with these two areas. So for nasal cannula, I will assess for the skin breakdown at least once a shift, but for non-rebreathing mask, I will assess every 2 hours for skin breakdown, redness, and irritated skin. However, for the nasal cannula and non-rebreathing mask, I also have to check with the doctor order. If the doctor order to check more for skin breakdown, then once a shift for nasal cannula or every 2 hours for non-rebreathing mask, then I will follow the doctor order. How are you doing? Good? Okay. So now time has passed. I'm going to the doctor order DCs using additional oxygen for Mr. Patton. So I'm going to remove the non-rebreathing mask off now. Hi, Mr. Patton. So the doctor order this DC's order for stop using the nasal the non-rebreathing mask or additional oxygen for you, because your oxygen level now is in a good spot and the doctor happy with it now. Is that okay if I take the mask off? Okay, thank you. I'm gonna pull this stripe. Discard the gauze. Okay. Detach from the oxygen source and discard the oxygen tubing. Perform hand hygiene. Are you in a comfortable position? Good. So here is call light for you, and I'm going out to document my oxygen administration with you. Is that okay? All right. Thank you.